Well, Basic Education Minister Angie Motshekga says it took advice from medical experts. This is the department taking advice from medical experts when deciding on keeping schools open. We're joined now by the department's spokesperson, Mhlanga. Mr. Mhlanga, good evening to you, and thanks for your time tonight. Perhaps a good place to start would be when it comes to the setting up of the special vaccine centers, in particular for teachers and administration staff at schools. How has that been going so far today?
Good evening, Kathy. It's been going well. We did not start now. The preparations have been ongoing for about 3 to 4 weeks now, and we're just waiting for the vaccines. Remember, the vaccines were supposed to have arrived 2 weeks ago, and there was a slight delay. And when that happened, we were already far ahead in terms of the plans that needed to be put in place before the rollout could begin. So all provinces are ready, and they're all waiting for the official start date, which is Wednesday.
So the official start date is going to be Wednesday. How many people are you hoping to vaccinate on a day-to-day going forward? And what is the commitment in terms of vaccine delivery that you have been told you will be able to have?
Well, the Department of Health has done a good job of distributing the vaccines, because it is not their first experience in this pandemic. They had been vaccinating persons older than 60, and that experience of setting up sites has come in handy when the preparations needed to be made for the basic education sector. So they are doing that part. We are preparing our people, all 582,000 of them, who should be going to the 281 sites across the country to get vaccinated. We estimate that about 91,000 would need to be vaccinated a day for us to be able to meet the target in the time period that has been set aside.
What are the concerns that you have had, whether it's from unions or even just from the experience of some of your circuit and district managers when it comes to the vaccine rollout? What is the sentiment from those who are working in schools right now?
Well, the big 5 teacher unions that we work with in the sector have conducted a survey which indicates that there's a lot more people now who are willing to take the vaccine. So that is the first challenge that has been overcome, because you might have the doses, you might have the sites in place, but if the people don't pitch, then you have a problem. But in this case, we know that a lot more people are willing to come through to get vaccinated. So that is one major challenge that has been overcome. What we now need to make sure that happens smoothly so is the movement of people from school to the vaccination site and back, because it's a large number of people that we've never had to manage at such a short space of time before. So we are going to be working very closely with provinces and district offices, as well as circuit offices, to make sure that scheduling at school level takes place in a manner that it does not create a gathering that we cannot control in the vaccination sites, but also that schools are not completely abandoned. A certain number of people need to remain in school while the rest go for vaccination, and they need to take turns making sure that we keep some form of schooling happening while vaccination is also taking place.
So listening to you, it sounds almost unavoidable that there is going to be a level of disruption to schooling during this period as you push for teachers and school staff to get vaccinated.
That's right. Remember what the minister said on Saturday. She said for the next 2 weeks, drop all and vaccinate. And that is consistent with our slogan from last year, where we said safety first. So if we put the safety of all our people as apex priority, then we're able to deal with the rest of the things that they need to do. They need to be in good health. They need to be of good mental standing, with the anxiety having been dealt with and the fear factor having been addressed as well, for them to be able to focus on curriculum, for them to be able to focus on supporting learners insofar as learning and teaching is taking place. So that is what we needed to do, and we believe that it's for a short space of time. Even that time that is going to be lost, it will be worth the effort. but we believe that schools will also be able to recover.
At this point, it doesn't look like there's going to be a situation where schools close their doors, at least in the ways that we saw last year. Is that an option on the table? And I'd be keen to know what are some of these circumstances that would trigger a move like that?
Well, we are a year and months into the pandemic, so we have learned some lessons and we have some experience behind us to learn from. And we have now come up with something called differentiated strategy, which means that which is affecting learners in Mpumalanga cannot be applied in the Northern Cape because the dynamics are not the same and the behavior of the virus and the behavior of the people in those areas is also not the same. So you have a third wave in the Free State, but you don't have a third wave in Mpumalanga. So don't close all the schools in Mpumalanga or all the schools in the country just because Gauteng is experiencing a third wave. We need to say, what is it that needs to be done in Gauteng, and then you localize the solution and not extend it to places where it is not relevant or not needed.
Mhlanga from the Department of Education. Let's leave it there for tonight.